Welcome to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. In this, the second section of Module 1, we will explore what it means to critically think about the evidence we gather to address our clinical questions. In the previous section of this module, we introduced several attributes of good research. First, in quantitative research, sample size, or the number of subjects in the study, affects how study findings may be applied to the broader population. Therefore, a larger sample size is desirable. Second, the study should clearly state what is being measured and employ appropriate statistical methods to analyze the data. Next, objective interpretation of results will prevent inaccurate conclusions about the data. Finally, following ethical principles when conducting the study and reporting results preserves trust and accountability among clinicians. It is important to understand how good research and its attributes are communicated, in particular via journal articles. The introduction section of an article relays the importance and relevance of a research topic. The methods section is a blueprint for reproducing the study. It explains how the study was conducted. The results section summarizes the major outcomes objectively and without interpretation. The discussion section is an interpretation of study findings. It considers the study's broader implications. We will now examine these sections in detail using an actual journal article. An article begins with an abstract, which is a summary of the study's major findings. The first component of an abstract describes the relevance of the study. This article calls for greater understanding of risks associated with post-surgical complications. The next component states the purpose of the study. Here it is to understand patterns of secondary complications following surgery. The third component focuses on the methods of the study. Here we see it was a large study over the course of several years, focusing on certain complications. The next component outlines major results. Here, patients who experienced certain index complications had higher odds of certain secondary complications. The final component discusses the study's implications. Here, the authors conclude that quantifying the effect of index complications presents opportunities for quality improvement. Now we'll concentrate on the introduction of the article. This is where the researchers make their case. It is where we find the purpose of the investigation. The authors state that clinicians have focused on reducing the incidence of complications in surgical patients, and that there has been a recent trend of dealing with the consequences of those complications. The researchers then provide the rationale for their study, which is to use patterns and outcomes of complications to help prevent patient mortality. The introduction is also a place to provide context. Here we see that index complications seem to lead to secondary complications, and that it is important to know more about complication sequences. Next appears the hypothesis, or main testable idea of the study. The prediction here is that index complications will influence a patient's risk for later complications in uniquely identifiable patterns. Following the introduction, the methods section serves as a how-to manual for replicating the study. This section typically contains information on study participants, outcome measures, and data analysis. In population and data, the researchers describe the source of their data and the time period of data collection. Next, they list the index complications they chose to evaluate. The authors go on to describe their inclusion of a reference cohort group to better assess the influence of index complications. Then come the study's outcome measures. In this case, there were 18 secondary complications, including pneumonia, urinary tract infection, and acute kidney injury. The researchers also mention an outcome that could not be studied due to its infrequent occurrence. Rounding out the methods section is information on statistical analysis. Here the authors provide more technical details on how they will assess the data. They describe a comparison of index complications between the two matched groups, and the use of a predictive model to determine the relationship between index and secondary complications. As is often the case, there is also a statement about the use of statistical software. Now we'll examine the results section. A common way to summarize results is in tables. Here, the researchers present the average age and standard deviation, or variability with respect to age, proportions by sex, race, and other demographic variables for each matched group. P-values, which indicate the chances of obtaining a statistic at least as extreme as the one in your sample, show that there were no statistically meaningful differences between these matched groups in most cases. Results are also presented in graphical format. This figure shows the changes in odds or chances of patients experiencing a range of secondary complications given the presence of specific index complications, for example, pneumonia. On the vertical axis is the odds ratio, and on the horizontal axis is the list of secondary complications. We see, focusing on two of the many dots in the graph, that patients with index pneumonia have over 15 times higher odds of experiencing reintubation or ventilatory failure. Finally, we turn to the discussion. The authors suggest they have quantified the magnitude of associations between index and secondary complications, and that these results may be used to make hospital-wide decisions when it comes to alleviating patient complication and mortality rates. Next, the researchers explain how their work extends on previous findings. An article will often include study limitations as well. Some of the limitations here include the time frame of data collection and asymmetry of the relationship between complications. Acknowledging potential flaws in a study is a sign of responsible communication. To conclude the discussion, the authors restate that index complications play a significant role in patients' risk of experiencing secondary complications. They also call for interventions that may prevent secondary complications and could ultimately prove to be life-saving for the patient. Now that we've examined the sections of a research article, we'll ask you to reflect on what you've learned. Which major component of an article highlights how to replicate the study? The methods section describes how to replicate the study and confirm its results. In which major section does a study's hypothesis first appear? A study's hypothesis first appears in the introduction of an article and is often restated in the discussion section. True or false? The abstract of an article contains all major sections of the article. The answer is true. The abstract summarizes each major section of the article from the introduction to the discussion. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations, you have completed the second section of Module 1.